Welcome to the Dental Debrief, guys. My name is Maheer. This is Dr. Tim. We have a practice here called Azure Dental in Perth, Inglewood, Western Australia. We're here to talk about the nuts and bolts of dentistry. So today we want to talk about old school dentistry versus new school dentistry. And what I want to know, Tim, is what are the biggest differences you see?
The amount of tooth that's cut, all right? That's the critical thing, because we're all living longer. Potential lifespan, at the moment we're talking 80s. In the future, I think we're talking 100 plus as an average lifespan for humans. So our teeth need to function for a lot longer than they used to. Old school dentistry cut away a lot of the tooth. New school dentistry, we try and preserve as much tooth as possible. There's no dentistry that we do that will last forever. So it's really, really important that we maintain as much tooth structure as possible.
What patients need to realize is that we're not God. And evolution has done an amazing job of creating a tooth, and nothing we can do is really actually close to that. There's a couple of reasons. The tooth has a nerve, so it's got something to sense pressure, sense temperature, and the tooth has a ligament, and that means the tooth can move a little bit as well. Anything we put in, especially like an implant, doesn't have those two features.
What are the biggest differences that you see between old school and new school dentistry?
So kind of going off what you said, the tooth, what we call in dentistry, has a life cycle, and we try to delay that life cycle as long as possible. So as soon as we have a tooth that has a filling in it, that tooth will keep needing that filling replaced, and the filling will keep getting wider and wider and wider until the tooth is more filling than tooth, and then it becomes what we call structurally compromised. And then after that structural compromise, if it breaks, or if the tooth dies, then it has a root canal, then it's much more high risk for breaking, and then it needs an implant. With new school dentistry, we're trying to push that as far into the future and really make each of those stages far from each other so that we get to the implant hopefully never.
Yeah, I feel that old school dentistry, there was much more of a willingness to cut into the tooth. Whereas these days, the justification that I would need to cut into a tooth that's never had any work done to it is so high, because as soon as you put your drill into that tooth, you're taking years and years off that tooth. You're potentially starting a process that ends with the loss of that tooth. So I think whenever you're going to drill a tooth, number one, I think for dentists, whenever you're going to be drilling a tooth, you need to be absolutely certain that that's 110% necessary. Number two, if you're a patient and you've been recommended a lot of treatment on your teeth and you've never really had dental treatment before, you really want to seek a second opinion first, because that drill going into that tooth could be a death sentence for that tooth.
The research is saying we lose 40% of the strength of the tooth as soon as the drill goes into it now.
Exactly.
When is the time to go into the tooth and drill into it?
The key thing is how deep that decay is into the tooth. Tooth has two layers, enamel on the outside, think of it like the skin on an apple, and then the soft dentine on the inside, you think about it like the soft inside of an apple. Decay in the outside enamel layer generally doesn't need to be drilled. We can fix those things with fluoride, tooth mousse, all these amazing products that we've got now to fix these microscopic holes before they progress further. To justify doing a filling, I want to see on the x-ray that decay is well into that dentine layer. Plenty of research now that we can actually heal those early lesions without drilling into the tooth. I know you use it as well, which is the artificial intelligence, the AI diagnosis of x-rays. And I think that's been a game changer for accurately assessing these, so we're not intervening too early and potentially taking life off those teeth. If you looked in a mouth, what would you have to see to justify bringing out your drill and cutting into that tooth?
So I'd say in the last 5 years, I've been more proactive with cracks versus decay. So if I start to see, there are certain teeth in the mouth that are very prone for breaking. The number one we see is the upper first premolar, and it's just evolutionarily designed really terribly. The roots of the tooth are sort of like a figure eight, and it's very prone to splitting vertically, which is completely catastrophic. We can never save the tooth when it splits down the middle. It actually happened to my mum. So there was a crack that I was monitoring my mum for ages.
Yeah.
And then she came in one day and half the tooth was missing.
Don't monitor cracks.
Yeah. So now I'm more willing to pick up a drill because the top of the tooth is the easiest part to replace. So if I'm suspicious that that tooth is going to crack, I'm more willing to promote treatment or recommend treatment to save that tooth. Just from my experience, knowing, watching these things, and monitoring these problems that we're always told to monitor.
Are there any procedures in old school dentistry that you would urge patients not to undertake?
I would be recommending to be very hesitant towards crowns, especially on natural teeth that have no fillings, never had work done, never had a root canal. We used to do crowns because the metals that we used had to stay onto the tooth somehow. So we had to drill the tooth into a shape that would hold the restoration with some glue. But now we have modern adhesives that are literally bonded to the tooth. So we don't have to remove all that tooth to make that shape, so like a helmet has to sit on the head. we can actually just make it kind of really smooth and really flat. So Tim, how about you? Any treatments that you would just urge your patients to kind of be hesitant or avoid or be careful with?
I think the main thing is any cosmetic treatments that is going to involve significant cutting of the tooth. Like what we've talked about already, each bit of tooth that you've got in your mouth is precious. There's no third set of teeth. We've got implants, they're nothing like natural teeth. They're always going to prioritize saving a natural tooth versus doing an implant. So I think anytime you're doing something elective and cosmetic, if there's a significant biological cost, we're cutting away a significant amount of tooth, you really got to assess how important it is to undergo that treatment, because there is a big cost involved, which I think in the past, people weren't made aware enough of.
There are alternatives, like we can straighten teeth, whiten teeth, and fill in the gaps with bonding, and there's no drilling involved with that.
Exactly. There's plenty of what we call additive ways of treating the teeth. So just adding to the teeth to improve their cosmetic appearance, as opposed to cutting them down to a stump like we see in sort of turkey crowns. So these days we're much more conservative. So anyone who's been recommended sort of invasive cosmetic treatments, you really need a second opinion. Maheer, are there any parts of dentistry that you don't agree with?
So my experience from when I was a young person, a young patient, and watching how I was taught dentistry, it was always you went to the dentist and the dentist just told you what you needed. And I think that's wrong. I think there's proactive care and there's reactive care, and those two options are good for different people. You know, if you're 99 years old, you can get away with reactive care. But if you're 18 and you're really young and you've just got your permanent teeth, then it's better to be proactive. For example, we might remove wisdom teeth proactively. So I think now what I really disagree with is you go to the dentist tells you need this, this, and this done. Tim, you obviously do a wide range of procedures, probably all the procedures in dentistry almost. Is there anything you don't agree with?
I love implants when they're appropriate, all right? And I think the problem has been, at least in dentistry at the moment, is the willingness to sacrifice natural teeth to place implants. I think natural teeth, people don't realize just how good natural teeth are. You know, natural teeth have different innovation to implants. They feel different, they function different, they're more resistant to disease. There's a real willingness to just, when people have a lot of problems that's going to require a lot of work to fix, to just take out everything, put some implants in, new set of teeth. The problem is implants can fail. And when those implants fail, they'll usually take a lot of bone with them. So the question is, are we able to do that procedure again? So if you're removing someone's teeth to put implants in, and those teeth could be saved, if that patient subsequently has a problem with those implants, and we could have saved those teeth, it's a real ethical problem. You wonder, why was that treatment recommended to begin with? I think we always need to be trying to save natural teeth.
So Tim, we obviously studied together, we all went through all the exams together, it was like very hardcore theory based, but when did you find dentistry was sort of like a creative outlet for you?
I think the big thing was that when I graduated, I'd viewed dentistry as a dentist, as someone who, when I graduated, I viewed a dentist as someone who just did a limited number of procedures. They cleaned teeth, they did fillings, they did crowns, and they took teeth out. After graduation, I was lucky because I worked in Singapore for 4 years, and Singapore's, I would say, is about a decade ahead of Australia in the way the industry operates. And over there, a lot of general dentists were learning, oral surgery, implants, orthodontics, periodontal surgery, and really broadening their scope of practice. In Australia, the attitude had always been that the general dentist just does the basics and the hard stuff is referred off to the specialist. The problem is that when you're seeing multiple specialists, it becomes very, very expensive. At least for me, when I realized that I could undertake a lot of courses and massively broaden my skill set, and I could do some really creative cases. Because as opposed to your toolkit just being filling, extraction, crown, our toolkit now is orthodontic, surgery, implants, ceramics. It's so broad. There's so many ways to solve each problem. And I think when I realized, I think by learning a very wide array of skills, it allows you to come up with some really creative outcomes for patients that suit people better, suit their budgets better, and just work better.
And it's convenient. You come to one clinician that's going to look after you from the start of your journey till the end of your journey. You go to one place, everything's familiar, you just feel a bit safer.
Yeah.
And you're in good hands.
When was the first time that you started to realize that dentistry was something that could be a creative outlet for you?
That's a good question. So for me, when I grew up, I was playing, I was like listening to a lot of hip hop. A lot of my friends were really into hip hop. So as soon as I graduated, all my buddies were like, you got to get me grills. And I was like, yeah, this would be pretty cool. I tried to find people in Perth that were doing grills. There was really no one.
Yeah.
Maybe one guy who barely was promoting his stuff. So I was like, okay, I'll get it for my buddies. And then a few people first started finding out, oh, I can do gold teeth. And gold teeth have been around for thousands of years. People have wanted to put gems and gold and diamonds in their teeth for so long. And it always would mean you damage the tooth. You'd have to crack the tooth. You'd ruin the tooth to try to get this gold on there. And now we can have options where it can just be removable, just slides over the top and kind of looks like you have a gold tooth. And I just thought it was really cool. But now I've learned adhesives and biomimetics and sort of the stuff we teach. So I can do this type of work really minimally invasively and really bonded to your tooth, which is like never been done before.
Maheer, how would you know if you've got an old school or a new school dentist?
I think easiest way to tell is that they're not afraid to share their work. If they're sharing their work, it just tells so much. It tells their attention to detail, they've got some confidence, they're not afraid of being criticized, and they're taking photos and they're using all the techniques that are up to date because they're not afraid to share their work. How would you know if you had an old school dentist or a new school dentist?
It's communication, 100%, because with an old school dentist, in the past, it always operated in the sense that you would rock up to the dentist, be told what to do, given a bill, and then you book in and do it. I think medicine and dentistry are both changing. The days of being told what to do by some figure are gone, and people are starting to take ownership for their own health. So people are doing their own blood tests. People are really looking about which doctor they want to see, you know, based on their philosophies. And it's the same with dentistry. So I think the old school dentist never really communicated too much. What we try and do here is we take photos, we take digital scans, x-rays, and then we accumulate all of that data and go through it together with the patient to identify problems. So the patient's part of the journey. They're making decisions with you. We never tell people what to do. We give options, we give costs, we discuss advantages and disadvantages, we show them the problems, and we let them make up their mind.
So as you can tell, dentistry is changing so much, and we're right in the middle of that shift. So if you're a young dentist and you're kind of lost, you've just come out of uni, you've been taught all this stuff, and then you're hearing all this new stuff, just feel free to reach out. We run courses to help you get up to speed in this. We call the brand's called BAD, Biomimetic Aesthetic Dentistry. But just shoot us a message or a line, give me a yell, and we love talking about this stuff. So just let us know. We'll be more than happy to help.
Guys, thanks for tuning into the Dental Debrief. If there's anything you want to discuss, if there's anything you want to know, or if you've got any burning questions, just leave a comment below or hit us up with a private message and we'll be happy to get back to you.